Within a society where man is constantly growing, there is a group of people who adapt day by day to daily life, despite their conditions. However, what happens when society doesn't adapt to this population group?
Una discapacidad creo que es un poco, yo diría que no es posible, ¿no? Yo he pasado de ser una persona normal, de caminar en la calle, de divertirme, de bailar, a estar postrado en una silla de ruedas.
La gente se me quedaba mirando como que con lástima, y eso es lo que me enojaba, que me miraban con lástima en vez de que me miraban como una persona normal.
In our country, the visibility of the population with disabilities has gone through a long evolutionary process. We're conscious of this reality, but sometimes we don't understand the magnitude. If we check the national statistic, we can appreciate that 1 in 10 people is a person with disability, and that means that 3 million Peruvians present some permanent difficulty or limitation. In fact, according to the National Survey on Disability and the last census of 2017, this population increased in 93% over 5 years, being Callao one of the regions with the largest population with disability. If we consider the type of disability, the visual and motor limitations are first and second place. If we focus especially the health sector in Callao, where the strategies are limited, we can identify that similar to the rest of district in Callao, the district of Bellavista, with a population of almost 10,000 of people with disability, are trying to create different initiatives to include this special population in the physical activity as a strategy of prevention of disease and promotion of health. These efforts sadly are insufficient to understand and identify the experience and limitation that the family, the social environment have, how they identify these barriers to make different exercise and physical activities. And that's the reason why our investigation is focused on this, identify the familiar and social environmental barriers that the people perceive.
Literature review. In here we find different investigations that were carried out in our study populations. One of them is the investigation of Bachelor Husa, whose name is Sport and Quality of Life in People with Physical Disabilities. Clearly, one of the benefits of doing physical activity is by their health compared to those who don't perform but are for multiple reasons. For example, the lack of a person to help them perform physical activity and structural barriers. In other words, the lack of suitable environment of them. In the conceptual framework, we want to describe the most important terms of our study to clarify the subject. We start with physical activity. The World Health Organization refers to movement, interaction, the body, and human practice, has seen many other manifestations of life. Physical activity brings together a biological dimension, a personal dimension, and a social-cultural dimension.
Perception. The 22nd edition of Dictionary of Spanish Languages defines perception like the inner sensation that results from the material impression made on our senses. The brain is the one that interprets the complex flow of information from the senses. Another important concept is physical or motor disability. This is an alteration of the motor apparatus caused by poor functioning of the CNS, the muscular system, the skeletal system, or an interrelation of the brain, which make it difficult or impossible the functional mobility of one or more parts of the body. Barriers. Those that prevent or inhibit student participation are called barriers, and those that make the implementation or inclusion successful are called facilitators. Family and personal barriers participations in some cases encourages limitation of personnel or host environment. Now, family environment. The family is a nucleus made up of people united in kinship or relationship of attachment. It is in charge of satisfying basic needs, in addition of providing love, protection, and affection of the members that compose it. The family life cycle we could see as processes or developmental stages. At each stage, there is learning and performing of certain tasks. So the family is the essential social unit from which society develops and organizes. Social environment. The social environment of any individual is formed by their living condition and work, the studies you have completed, your income levels, and the community in which you form. It represents the social dynamics, costumes, and values that the individual brings with him that are part of their behavior too.
The type of study that we are going to do is qualitative and have a phenomenological and methodological approach. The study population will be made up of people with motor disabilities between the age range of 35 to 59 years old. These people have to live in the Bellavista district of the constitutional province of Callao. We made the inclusion criteria and the exclusion criteria. The inclusion criteria are three. There are people with motor disabilities that are in the age range of 35 years old to 59 years old. Also, people with motor disabilities that live in the Bellavista district of the constitutional province of Callao, and also people with motor disabilities of both sexes. Also, we have the exclusion criteria that are four. On the other hand, we have exclusion criteria that are people who has more than one disability in addition of motor disability. Also, people who have a condition that prevents them from expressing themselves here in the interview, and also people who have a condition that prevents physical activity. The procedure will be carried out through a theoretical sampling. This means that it's a non-probability sample. So we will to describe a particular group with the same characteristics. That's why the size of the sample is linked to the information that the participants give us. The participants will be approximately 20 and they have to be in the range age of 35 years old to 59 years old and live in Bellavista, Callao.
For the data collections, interviews will be used in order to allow participants to express themselves freely. Therefore, a trustworthy space will be created, avoiding making value judgment in relation to what was said by the participants. Likewise, a semi-structured interview guide will be used with keywords that guarantee the approach of all the dimensions of the research, starting by exploring the conceptions that the participants have built around their disability, continue to address the frequency and duration of physical activity that they have already been doing, and finally inquiring about the barriers they perceive to carry out physical activity in their family and social environment. The information will be collected through interviews recorded with a prior informed consent. Later, they will be transcribed and will go through a control process using the qualitative analysis program Atlas TI. It should be noted that this research will go through an inspection process with the Ethics Committee of Peruvian University Cayetano Heredia. Also, the willingness and reliability of the participants will be considered during all that process. Finally, we plan to conduct the research for 8 months between February and September of 2022. So we're seeking for funding to cover the total budget equivalent to $7,000. Investment that will bring much greater benefits, helping thousands of people with disabilities in Bellavista, Callao to lead a healthy lifestyle with the support of a strong government intervention that truly respond to their needs. To contribute to this research, do not hesitate to contact us. In advance, thank you so much.
We can make a better Peru.
I support people with motor disabilities.
We are in this together.
We can do it.